Welcome back. The FDA released new guidelines requiring mammogram providers to notify patients about breast density. With these updated guidelines and the addition of AI technology, health professionals are expected to detect breast cancer much earlier. Joining me to discuss this effort is the Director of Radiology at MSK Westchester, Dr. Sandra B. Brennan. Doctor, thank you so much for joining me.
Thank you for having me.
Now, as I mentioned, the FDA's new rules will require mammogram providers to just notify women if they have dense breast tissue. Can you first just, explain what does it mean to have dense breast tissue?
Sure. So breasts are made up of fibrous tissue, glandular tissue, and fat. And depending on how much dense tissue you have compared to fat determines whether you have dense breasts or not dense breasts. So a radiologist can tell by looking at the mammogram if a woman has dense breasts. And about a half of women have dense breasts.
And how could that be a threat? If your breast tissue is very dense, how could that be a threat to detecting breast cancer?
So, having dense breasts actually increases your risk of developing breast cancer. We know that women who have extremely dense breasts compared to women who have fatty breasts have a 4 time increased risk of developing cancer. In addition, it's harder to detect a cancer on a mammogram if you have a lot of dense tissue because the cancer may appear white on the mammogram and may be obscured by the white overlying dense tissue.
Now, for those who do have dense breast tissue, what could their screening process efforts look like? And, how may it differ for somebody who has maybe less dense breast tissue?
So by empowering patients, letting them know that they have dense breast tissue, then they can make informed decisions about their screening and how that should look. So women with dense breasts may consider supplemental screening, such as breast ultrasound. At Memorial Sloan Kettering Cancer Center, we also offer supplemental screening with contrast mammography, which is shown to be almost as sensitive as MRI and very accurate. And depending on a woman's other risk factors and their density, they can tailor their screening based on that. They can talk to their healthcare provider and decide which screening is best for them.
And can you quickly just go over, what some of those risk factors are? Because I know a lot of people, sometimes they often don't really pay attention to it, or they don't think it's something that can necessarily happen to them. So can you quickly just explain what those risk factors are?
Sure. We have modifiable risk factors and then non modifiable risk factors. So, non modifiable risk factors would be being a woman, of course, having dense breasts, your age. So, as you get older, your risk of developing breast cancer increases. And then non modifiable risk factors would be your family history. So, having a lot of relatives, women in your family who've had breast cancer or having a man in the family who's also had breast cancer. So these are certain things that will increase your risk. Then we know there are also genetic alterations that can increase your risk. So having a gene mutation will increase your risk compared to the average woman, such as the BRCA gene, CHEK2 mutation, and then also having received radiation at a young age to the chest will increase your risk of developing breast cancer at an older age.
Now, according to the CDC, women with dense breasts have a higher chance of getting breast cancer. You also recently just said this yourself. Can you just explain whether or not is this a common current occurrence? So, is this something that most women should be fearful of or concerned about?
So I think it's important to know that having dense breasts does increase your risk of developing breast cancer, and then those women can be more vigilant, checking for changes and how their breasts normally look or feel, and also being very vigilant about their screening. If you know you're at a higher risk, then you want to make sure you're going for your annual screening and also doing supplemental screening if necessary. So having dense breasts increases your risk and also makes it more difficult to detect cancer on a mammogram.
Now, I think this is where things get a little bit more interesting. With the advancement of technology, AI can be used to detect breast cancer. I just want to know, as a health professional, what were your initial thoughts when you heard that this was something that could be possible?
So, breast cancer is the leading cause of death amongst women across the world. So, any tool that will help us to strengthen the fight against breast cancer, I welcome. So computer-aided detection has been around for over 2 decades, but now with artificial intelligence, that tool has become more refined and more sensitive and accurate.
And can you just talk a little bit more about computer assisted detection and just explain, how that process actually works?
So the technology at the heart of AI systems is called a neural network. This is like deep learning. So machines are fed a vast amount of data. So in the case of screening, we feed them normal mammograms, abnormal mammograms, and they learn to recognize patterns and images and detect cancers. They can segment lesions and increase the speed at which the images can be reviewed, highlight areas on a mammogram for the radiologist to hone in on, so they can be tools that can help radiologists in detecting cancer on a mammogram, so that we can find cancers as early as possible.
Now, how does this compare to more traditional ways of detection?
So traditionally, the mammogram was actually a 2D mammogram, which is 4 images. With newer technologies, now we have digital breast tomosynthesis, also known as a 3D mammogram. And compared to traditionally having only 4 images to look at, we now have hundreds of images to look at in a single mammogram. So with artificial intelligence technology that can help us to look through all these additional images and help the radiologist to identify abnormalities and also streamline our workflow and help triage cases that are require more attention.
Now,
So traditionally, a radiologist read the images alone or double read with another reader. And early CAD systems didn't show any benefit with, the technology 2 decades ago compared to a radiologist reading alone.
yeah, so I wanted to touch on the fact that you said it's kind of been around a little bit for about 2 decades. And I'm just interested to know, as a doctor and a healthcare professional, how have you seen this technology or just the use of technology really transform, the healthcare field just in a positive way?
So, anything that will help us to do what we need to do to help, to read our cases, to identify cancer as early as possible, and to allow us to do our procedures. So, there's a lot involved in being a radiologist, not just looking at the images. We also do biopsies and preoperative procedures for patients going for surgery, for lumpectomy. So having tools that will enable us to do our work efficiently and give results accurately and fast are, something that we will embrace.
Now, one major study estimates that mammogram screenings miss about 1 in 8 cases of breast cancer. How will CAD help lessen that number? Or, what are some ways you hope that we can continue to grow so that number can be a lot lower?
So we know that mammograms are not perfect, and mammograms affect, are better for some women compared to others. For example, women with dense breasts, the mammogram, the sensitivity is not as high in a woman who has non-dense breasts. So we hope that with AI technology, that it will help us to identify lesions in, more difficult dense breast areas, so that we can detect cancer early.
Now, I'm sure with anything that has to do with technology, there's always like the good and the bad. So I'm curious to know, are there any cons to relying on advanced technology like AI in the healthcare system?
Well, this is still relatively early. We need more clinical trials to show that the results are stable. The data that has been fed into some of the systems are from populations, and we know there may be some disparities in cancer across populations and socioeconomic groups. So we don't know if there are disparities in the information or data that has been fed into these technologies that might be reproduced then if it were just rolled out without, vigorous trials to show that it's reproducible and stable. So I think, until we know that, and it has been tested on complex cases, for example, post-operative breast, maybe a difficult complex case where, the AI may have difficulty detecting benign from non-benign lesions. So we want to make sure we don't overcall or have too many false positives. And also, of course, we do not want to have any false negatives.
Now, despite technological advancements, people should always just be alert when it comes to their bodies. So, can you just explain for people who have breasts, what should they do before they get screened, or how should they know when it's time to get screened? Could you just let everybody know that kind of information?
Sure. So women should be familiar with how their breasts feel and look, and be aware of any changes or lumps that they feel, if they notice any skin changes or dimpling, rash, any itching of the nipple, any nipple discharge. These are things that they should alert their healthcare provider about. And then we recommend that women start screening at age 40. We know that this leads to the most lives saved, and the strongest reduction in mortality by starting screening at 40. And I think that's the most important take home message, that while we have all these new technologies and artificial intelligence to help us, the most important thing is that women actually go and present for screening, because a mammogram will detect the most cancer and will save lives.
All right. Well, doctor, thank you so much for joining me to have this discussion.
Thank you.
If you want to know more about the MSKCC, please go to their website at www.mskcc.org. Stay tuned, we have more open for you right after this.